Good afternoon, everyone, and welcome to our bi-weekly All In for Kansas Kids webinar. It is April 21st, 2021. We're happy to have all of you here with us on our noon hour today, and we have some good information to share from you. Hopefully we can all learn and continue helping us to do better in our early childhood work in Kansas. Our agenda today is very simple. We're going to be covering our general updates like we usually do, and then we're going to be hearing a presentation from the Kansas Child Care Training Opportunities, better known as KCCTO. I want to start today by presenting information to you on the finalized and approved Kindergarten Transitions Toolkit. And many of you are probably already familiar with this, but for anyone who is not, I would like to take a couple of minutes to give you some background on it. Several months ago, the Early Childhood Recommendations Panel tasked a work group to develop resources that can support active community planning for successful transitions. Here I go again. From early childhood into kindergarten, excuse me. So this work group was comprised of individuals from the recommendations panel and also represented the mixed delivery system of early childhood in our state. And they met several times and they developed a toolkit that included a memorandum of understanding and a work plan template as components for the toolkit. So last December, the toolkit was taken to the Children's Cabinet for their approval, which was received. And it was then presented at the Early Childhood Stakeholders Group meeting. And some of you were probably there for that. And we asked the participants to brainstorm ideas on ways to disseminate the toolkit. And those ideas were then taken to the work group, who made additional enhancements that include a benefits checklist for all users who can benefit and how, an email template that can be used by agencies and organizations for dissemination, and then just an introductory page that talks about the importance of successful transitioning into kindergarten and also the collaboration and planning process that it takes. So keep in mind that this toolkit is to be used as a starting point by communities to adopt or adapt as needed to fit their local needs. So on April 9th, just recently, the Children's Cabinet, acting as the Kansas Early Childhood Advisory Council, granted their final approval for the toolkit, which now lives on the Children's Cabinet website at this link. And we encourage you to please take a look at it. And now that the toolkit is complete and accessible and editable on the Cabinet's website, we need your help. We ask that all of you here today consider how you can share this toolkit throughout your networks and how you can use this toolkit in the work that you do. And I just looked today and we already have over 100 downloads of this toolkit since we rolled it out on April 9th. So I think that's very exciting and shows that there's a lot of need for this. So it can be disseminated or used by all early childhood stakeholders to include our state and local partners, organizations, initiatives, and all communities. So your help in sharing and using this toolkit is vital to the promotion of the success of kindergarten transitions throughout the state. So, and if you ever have any questions about that, please let me know and I can try to answer or send you to the right person that might have that information. Moving on to the Early Childhood Recommendations Panel. So I want to share a little bit of information on this too for anyone who might not be familiar with it. We have many people on here, I think, that serve on the panel, but some of you may have never heard of it. So in early 2020, Governor Kelly designated the Kansas Children's Cabinet and Trust Fund as the Kansas Early Childhood Advisory Council. And that council provides oversight for early childhood in Kansas, to include the All In for Kansas Kids strategic plan, which I'm sure you've heard about before, that is ongoing for 5 years. And so the executive order also stated that the cabinet should convene and maintain a panel with members who have early childhood expertise to operate at the pleasure of the cabinet in an advisory role. And so the recommendations panel was formed, and the members that serve on it serve in a 1-year term of service. And so last year, during the first year of the panel in 2020, applications were accepted and members were appointed, and the first meeting took place in July. And the application process is now scheduled to take place annually, beginning in April each year. And then the final slate of applicants will be presented to the Children's Cabinet at their June meeting for approval. And just as a reminder too, the panel meets on the third Friday of each month, and you can access those meetings on the Children's Cabinet website to watch on YouTube as it's happening, or just to watch at your convenience at a later time. So the application process is now underway for year 2. So applications are being accepted through May 1st. So you have about 10 more days this year to apply. That application can be found on a link at the Children's Cabinet website. You go to About, and then click on the Early Childhood Recommendations panel, and then you go to the new panel membership application link to find it. So any Kansan that's interested is welcome to apply. And then once the applications are reviewed, recommendations will be presented to the Children's Cabinet this year at their June 4th meeting for approval. And then the membership year will start on July 1 and extend through June 30th of 2022. So again, if you have questions, please contact me. We do encourage people to apply or to reapply if you're already a member. And then our new year will start this summer. We are now going to move into our program for today. We wanted to allot as much time as possible for this. So the people that we'll be hearing from today, Chelsea Schulte is a program coordinator with the Kansas Child Care Training Opportunities, or CCCTO, and Patty Peschel is the director. And they will be providing a high-level overview of professional development opportunities offered by CCCTO, and then an update of their PDG subgrant work, as well as an overview of the Infant Toddler Specialist Network. So we welcome CCCTO here with us today, and I am going to let them take over with our program. So welcome and thank you for being here.
All right, thank you, Debbie. I appreciate it. My name is Patty Peschel, and I'm the director for Kansas Child Care Training Opportunities. I want to thank you for the opportunity to share what projects CCCTO staff have been working on, and for us to be able to share opportunities for engagement and collaboration. Kansas Child Care Training Opportunities, otherwise known as CCCTO, is a statewide training office dedicated to providing quality, accessible professional development opportunities to family child care providers, child care center staff, and other early education professionals throughout Kansas. CCCTO is a sponsored project of Kansas State University through the College of Health and Human Sciences. So through our sponsored project, we have 2 main projects, the Workforce Development Project and the CCCTO KITS Infant Toddler Specialist Network, otherwise known as ITSN. Both of these projects are supported through a grant from the Kansas Department for Children and Families. The source of that funding is through the Child Care Development Block Grant. So first, I want to be able to give a brief overview of the Workforce Development Project, and then our staff will provide more in-depth look at the services we provide. So part of the workforce development project, we have multiple pieces that go into the workforce development project. The main one, of course, is the professional development that we provide. So professional development we define as both includes training and technical assistance opportunities. And formats for that include online, virtual, and in-person. We also have a statewide training calendar that can be found on our website. And I believe they're going to put a link in the chat box that will link to our calendar and the registration form. That statewide calendar includes CDA offerings, including both through the Workforce Development Project and ITSN, as well as any partner trainings. One of the main ones is Child Care Aware. We also have their trainings advertised on that statewide training calendar. Do want to let you know if you are providing training, both KDHE approved and also other opportunities, we are happy to advertise those for you. So please contact CCTO if you are interested in advertising on that training calendar. Another part that we have as part of the Workforce Development Project is the Workforce Development Advisory Group. That group meets on a monthly basis. The next meeting is this Friday, April 23rd at 9 a.m. If you're interested in joining that group, we can also put information in the chat box there about contacting Linda Logan if you would be interested in joining that group. Part of that group, we have 3 subgroups that are currently meeting, which includes the core competencies and career pathway subgroup, the individualized professional development planning group, and the diversity, equity, and inclusion group. So that group, the purpose is to provide advisory for anyone serving or providing professional development for early childhood professionals or those that contribute that are the recipients of that professional development. Another piece of the Workforce Development Project is the scholarships. We have scholarships available for childcare providers to attend professional development opportunities and for community college attendance. And then also our CDA support. We provide a CDA training track and CDA scholarships. So next, I believe Vicki Sutton, one of our program coordinators, is going to go and talk more in depth about those professional development opportunities.
Yep. Hi, as Patty said, my name is Vicki, and I'm on the Workforce Project. I'm going to give you an overview of our professional development. So our main courses are asynchronous online courses, and we currently have 90 of these. They're week-long courses. We start 2 sessions a month, so every other Thursday. We also have a 2-week, 18-hour foundation module, and this is our initial health and safety training. It starts every Thursday, and then we also start a Spanish module on the first Thursday of every month. And so in addition to those regular online trainings, we've started introducing a variety of new formats to better meet the early childhood professionals, their needs and their preferences for training. One of those is the extended online. These courses are 2-week courses, and we currently have 6 with 2 more in development. Our extended courses are developed on a learn apply model, and the first week runs really similar to those 1-week long courses. But during the second week, participants engage in offline activities where they're using that course information in some way. For example, in Yoga Paloozas, they're doing yoga with the children. They're journaling about their experience, and then they come back online and complete online activities. The extended courses also all have Zoom sessions. Some of the courses it's required as part of the course, and others it's an optional session. So the extended courses, the participants are also added to an online community of practice, and that online community of practice is an ongoing group. So everybody that takes a Strengthening Business Practices extended course gets put into the group, and they have that access beyond the course. Through all of our different formats, participants have continued access to the course content for 1 year. And so that is true for our 1-week one, our extended, and then the other ones that I'm going to talk about. So our next one is our book studies. Book studies are 5-week courses, and we currently have 2 different series. Each series offers 1 training each quarter. So by chance, tomorrow, both series are starting a course and will run for 5 weeks. The leadership series we have 2 courses, and then we have 2 more books in development. This series is for program administrators and directors, as well as group family child care providers who have staff. One thing to note about these is the book studies have a weekly Zoom that's held Wednesday at 1 o'clock as part of that. The educator series, and this one is for those people in direct services, and this is a new series for us. In fact, the course starting tomorrow will be the first session of that first course running. We have 2 more in development beyond this one that starts. And this series, the format differs slightly for each book. Some have a focus of online discussions, and then the second book coming up will have a mix of online discussions and Zoom discussions to kind of, again, fit the participants' needs. The next one is our virtual courses. So virtual courses are kind of a blend, really a true blend. Training is provided synchronously through Zoom, and then followed by an asynchronous self-reflective piece. Our workforce virtual trainings launch from Canvas, which is our LMS. And that launch pad not only provides the Zoom link, but it also provides the resources and that continued year access to the content. We have 8 virtual training on the workforce side, and our next one that is in development is going to be a Spanish virtual training. So our newest course format are our training modules. Training modules will launch in June, and this format just allows participants to explore a specific topic in a greater depth than they can do in the 1 or 2 week courses. The design is, again, that learn apply model. Training modules will run for 8 weeks, and they're going to be between 12 and 14 KDHE hours. So the general format of these, in the first week, participants are going to engage in a community building activities. They'll gain an overview of the training topic module information and also do an overview of SMART goals. And then they use that information and create a focus area statement, kind of an adapted SMART goal. And that focus area is what will guide their work through the different activities throughout the training module. The training modules also really focus on peer-to-peer sharing and learning. Excuse me. So throughout the training module, there's a lot of interactive online discussions. There's also an area where the participants will create like a community library of resources and activities based on that training module. Through each training module, we'll have a minimum of 2 group Zoom discussions. And these are really intended to be discussions. The trainer will facilitate them, but they're not presenting information. The participants will do a lot of small group breakout rooms and then come back and share, more like an in-person. Each training module will also have one one-on-one technical assistance meeting where the trainer and the participant. And so they're going to talk about their content, their focus area statement, their work through their activities, things like that. And then in the last week, they come back together in peer-to-peer learning discussions. The participants kind of do that aha moment through the training module. And they'll do a reflective piece on what they gained. Also, each week, they're also doing a personal reflective journal on the week as they go. And so that's a little snapshot of some of the different professional development that we present. And next, I'm going to talk about a new program, our professional development partners. So this is new, launched last month. This program is just another layer in providing virtual technical assistance to the early childhood professionals. This program is offered statewide and available to anybody in a licensed child care program and to people that work with any age, birth to 12 years. The program is based on the foundation that technical assistance is grounded in relationships, but also that the early childhood professional guides the support. What type of support is based on their needs and interests, but also what level of support they want. So the program is optional. There's no limit to the number of people that can opt in. People can opt in from all of our online courses, virtual courses, any of those formats that I talked about. They can opt in from CDA Central, which is our resource hub on our LMS, And they can also just call the office, email the office, or use our website contact us form. And we'll get them paired up with a training and technical assistant specialist. And we have kind of some different filters for pairing. So for example, anybody that identifies as a director or an administrator, we'll pair them up with our TA specialist that provides the director administrator TA. Kind of the same. If they opt in during their foundation module, they'll be paired with their trainer for that module to continue that relationship that they've started during the 2 weeks of the foundation module. Then we have other filters to kind of work on pairing people up. So as I said, the foundation for the program is really that individualized support based on the early childhood professional specific needs, their interest, and their preference for the level of support. The program is really guided by them, what support they want or prefer. Some may just want that quarterly professional development newsletter. Others might check in a couple times a year to get advice on what training or conferences are available. And then others may want that higher level of support. The training and technical assistant specialist will be reaching out, but primarily the support is going to be guided by that early childhood professional. And there's no requirement for any number of contact. So they might opt in and really just want that newsletter, or they might want monthly or weekly contact with their trainer. And the support is your typical training, technical assistance, coaching, mentoring that you can do virtually. So things like assistance in finding in-service or training opportunities, assistance with a specific challenge, assistance developing an individualized professional development plan, or finding resources and toolkits and strategies, or helping them connect to an organization that specializes in something like Tiny K or DCF, and those local and state and national organizations. Or maybe finding a developmentally appropriate activities. And again, that quarterly newsletter. So really, it really is guided by what the professional wants and what level of support they want or need. So that is a real quick snapshot of our new professional development partner program. And I am passing it to Haley.
Hello, everyone. My name is Haley Heenick. I am a program coordinator with the Workforce Development Project at CDA. One of the things that I manage is the scholarship program that we have. We have two different overall types of scholarships. We have progression and professional development scholarships, and then we have scholarships to help pay for the Child Development Associate credential application fee. So I'll start with the progression and professional development scholarships. We have some applicant eligibility requirements for these scholarships. To be eligible, you have to have worked in the same licensed child care program for at least the last 6 months. You have to be a Kansas resident, and the child care program that you're employed at, whether that's a center or a family child care, needs to accept DCF child care assistance, so DCF subsidy. And then within this overall progression and professional development scholarships, we have a few different types that are available. So we have clock hour training, continuing education unit training, higher education, and child development associate. So the CDA credential training. You can apply for a scholarship for any of those types of training. For the clock hour training, the scholarship will cover the registration costs for those. The continuing education unit, the CEU training, the scholarship will cover any CEU fees and the registration costs for that training. For higher education, the scholarships will cover 80% of the cost of tuition from an accredited Kansas community college. And those courses can be used for someone who's working towards their early childhood education associate's degree, if they're working on a certificate in early childhood, or if they're working on courses for their director's credential. And then for CDA training, we have two different areas or avenues you can go. We have scholarships for anyone who's working on clock hour training for their CDA. So the scholarships will cover up to a maximum of $400 of training in a training program. So not just random courses, but if it's a specific training program, up to, if that program is $400 or less, the scholarship will cover that and up to 120 clock hours. Or if you are someone who's working on your CDA and you want to take college courses, if you find a CDA program at a community college in Kansas, the scholarship for that type of training coursework will cover 80% of the cost of tuition for up to 9 credit hours. And for both the higher education and the CDA training at community colleges, that scholarship is reimbursement based. So we'll cover 80% of the cost of the tuition for those courses after you have completed the courses. And then for our CDA credential application fee scholarships, the applicant eligibility is very similar. You have to work in a licensed childcare program in Kansas for at least the last 6 months, and you have to be a Kansas resident. For these scholarships, though, you don't have to accept DCF subsidy. We have 2 different types of scholarships. So if you're a first-time candidate, you're working on your first CDA, we will cover the cost of that application fee, which is $425, as long as you've met all of the pre-application requirements. And then we also have scholarships available for people who are working on renewal for their CDA. So as long as you've met all of the requirements for the CDA renewal application, we'll cover the cost of the renewal application fee, which is $125. So for more information about both of these scholarship types and all of the individual scholarships that you can apply for, our information is on our website, which is in the chat. There's additional information about policies and procedures for each of those specific scholarships there. And we also, along with scholarships for CDA, we have CDA specific support. So we offer specific courses related directly to the CDA. We have orientation to the Child Development Associate credential, which is offered once a month. Introduction to the CDA portfolio and developing your CDA portfolio. Those are both specific to the CDA portfolio. Those are offered on a rotating basis as well. You can find those courses on our website. And then all of our other courses will indicate on our website if they have a CDA subject area. So it'll be easy for you to identify if they fit into your CDA training plan. We also have a CDA training track. So this is a training program where we offer up to 120 clock hours of training for your CDA. When you enroll in the CDA training track, you also get support with scheduling your courses and getting enrolled in those courses, making sure that you're staying on track. So we have an initial CDA training track, which is for the 120 hours of training for people working on their first CDA. But if you are renewing your CDA and need additional training for that as well, we also have a renewal training track. So the initial CDA training track is $120 for 120 hours. The renewal CDA training track is $45 for 45 clock hours. And you can use those scholarships that I had mentioned earlier for the CDA for these programs as well. And we also offer technical assistance around the CDA. So our training and technical assistance specialists, in addition to being very knowledgeable on a wide range of topics, we also have several training and TA specialists that are very knowledgeable on the CDA. So they can help you plan for your CDA, they can help you through the application process, anything that you might have questions about that process, we can help you out to the best of our ability. And if we don't have the answer, we can direct you to the council. But there's quite a bit of support available at CCCTO for anyone who is working towards their CDA.
Haley, I wanted to highlight, there's a comment in the chat. You had talked about the community college scholarships being reimbursement based. Wanted to address if the other scholarships, what the payment would look like on those.
Yes, so community college scholarships are at this moment in time, they are all reimbursement. The other scholarships, so all of the other types, Chelsea, if you can go back to that page real quick. So the clock hour training, continuing education unit, and then the CDA clock hour training, those can be paid in advance or paid reimbursement. So there's on our website, on the policies and procedures that we have outlined, it gives specific directions on what qualifies for reimbursement or pay in advance. But there are different options depending on the total cost of the training and when the training is set to, like when it's scheduled. So yeah, there are several different options there.
Also, I saw in the chat, Lana Mesner with CAME had shared that they, CAME offers scholarships towards CCCTO courses if people are applying for that, they are applying to the infant toddler mental health endorsement. So another opportunity there.
All right.
Oh, actually, sorry, Patty, we got a CDA question. Haley, do you see that in the chat?
Yes, I see that. So the possibility of a what is a CDA and what support is available, training or Zoom. Yes, there is the possibility for that. If you have, if you'd like to reach out to CCCTO, you can contact us and we can get with you about doing that. We've talked about having a training specifically for directors or support staff, you know, people who are trying to manage that for their entire group, and we have done that in the past. So we're happy to work with any of you who want to have a little bit more support there. We can get that set up for you. So just reach out to our email, and I don't know if we included CCCTO's email address in the chat at all yet, because that would
I'm
be
on it right now.
okay. Go ahead and yep, send that. send a request to that email address, and we will get in touch with you about setting that up.
All right, so this is just a list of collaborations that the Workforce Development Project works with. We work with a variety of organizations throughout Kansas to provide content-specific training. And so these partners help us by providing training, guidance, and support for a variety of courses. Many of the courses are led, facilitated by those content experts from those partnering organizations. As always, we welcome additional partnerships and sponsorship opportunities. One of the things through the funding through the DCF, as Vicki mentioned, Canvas is our learning management system. So we do have access to host trainings, and we've done that in a variety of ways. So if you are an organization that would like to present to providers virtually or through the online format, and you're interested in a partnership, please reach out to us as well. So before I turn it back over to Chelsea here, I also wanted to add to be on the lookout for the monthly webinar opportunities. We will be having webinars that will be supporting direct services and support services. Chelsea?
Yeah, speaking of collaborations, one of those is with the Kansas in-service training system, KITS, on the Infant Toddler Specialist Network. So that is one of the two major grant projects Patty mentioned at the beginning. The Infant Toddler Specialist Network is most commonly referred to as ITSN, and it is funded through DCF as well. Before we get into the services that ITSN provides, wanted to share this map of the infant toddler specialists across the state of Kansas. They are assigned to geographic areas because in a pre-COVID world, we were providing most or all of our services in an on-site face-to-face format. If you are interested in the services we talk about today, you would still reach out to the specialist that's assigned to your area. And we'll all keep our fingers crossed that someday soon we will be in an on-site capacity again. All of their contact information is also on our website, which is in the chat. But I also wanted to put in a plug that we do currently have some open positions for infant toddler specialists. These are positions that work from a home office, and we're particularly interested in finding some specialists to support us in serving Western and Central Kansas. So if you are interested, the job postings are in the chat. You can check those out, and there's contact information if you have additional questions. Sarah, I'll turn it over to you.
Hi, I'm Sarah Holmes, and I am one of the infant toddler specialists with the Infant Toddler Specialist Network. And I'm going to talk just a little bit about some of the services that we provide. Like Chelsea had said, we provide training and technical assistance across the state of Kansas. So there's always somebody in your area that you're able to reach out to. And also, like Chelsea had said, with COVID, all of our services have been provided via Zoom or phone or email. Hopefully, fingers crossed, with vaccines and things as they are now, we'll get back out into centers and programs. But a couple of the services that we do provide now via Zoom are trainings. We do some live virtual trainings where we are doing the same things that we were doing in face-to-face pre-COVID time. All of our offerings are on the CDA website, and you just want to click on the live or virtual offering tab or online course tab to check out all of those. We do work specifically to do training with centers in addition to those community-based trainings. So, I know we had a question in there about CDA things specifically for centers or for directors. If you are a center director, please reach out to one of the training specialists in your area, as we're able to do training specifically for a center. Which kind of leads into this next piece on here of consultation and technical assistance plans. As I don't know if Chelsea mentioned it, but all of the services that we provide are free of charge to providers. And our main goal is to work with providers. And I feel like probably the most relatable example that I can give when people ask me what I do, when I say I provide technical assistance to infant and toddler programs, they kind of smile and nod and say, what does that mean? And so I think one of the most relatable examples would be if you are a center provider or a home provider and you've had a toddler that is biting and you kind of are at the point of, you just have no idea what to do anymore. You've tried all of the things. We are able, well, at least once COVID is gone, to come into your program. We will usually do some informal observation, and then we might sit down with you and develop one of these technical assistance plans to go through some different resources and supports that we can show you how to use, and we can model and coach you through how to do that. Not all of our services are that intensive. We also have that consultation. So, like we showed you with the map, all of the different specialists, if you have questions, if you have a question about biting, we have a ton of resources and connections, which is that next point. We've got some great virtual kits, which are just a bunch of really well-researched internet links that will take you to research-based articles and research-based material to answer some of your questions about child development and some of those pressing issues. I guess next slide. I think that's probably good, unless there's something you want to pop in there with that. One of the programs that we have, that our program has developed, is the Child Care Center Directors Alliance. And this is a monthly training that they're specifically gauged toward directors. It was launched in October of 2020, and it's led by our specialists, Stephanie Haney and Joni Breidenthal. And if you have questions about it, you can contact Stephanie, and her contact information is in the chat box. The trainings are free. They're approved for 1.5 KDHE hours, and they're usually on Thursdays at 12:30. and you can register on the CCCTO website. They also have what they call a Zoom cafe, which is an hour during the lunch hour, and it's come and go on Thursdays at 12:30. Open forum, no registration. You know, they had said one of the directors kind of refers to this as her self-care. She looks forward to the opportunity to talk with other directors, share some struggles, successes, ask questions. So it's kind of really, it's an ongoing online community of practice that's specifically for center directors, because we know that there are a lot of different issues, COVID, non-COVID, that directors face. And it's nice to be able to talk to your peers about that. And this has just gone gangbusters. Stephanie and Joni have had to schedule extra offerings of some of the trainings. I know coming up, they've got the focus on the next 3 months coming up is going to be on self-care for directors and staff. And they've had to offer a couple extra sessions of the first training because there's been such interest. And it's just really cool to see how involved the directors have gotten with that.
You want to get to, you're tired.
Huh? Oh,
I'll let you from your eyes.
Want to hold on to that?
okay.
Here,
Um,
I'm just letting it play.
Yeah. Don't move that.
So then,
It's
let's
like-
see. So then the last part, one of the other,
Hey, Sarah, sorry, I just wanted to point out before you move on is that if there are directors listening today, that the best way to get involved is to take a look at the registrations for the upcoming trainings. But if they can't make it to one of those, yes, reach out to Stephanie Haney for more information on how to get connected.
thank you. So then our other kind of big thing that's happened is our Kids These Days podcast. I am one of the hosts of it, along with Rudy Benavides, who's a workforce development trainer. We launched back in August of 2020. We have over 3,000 total downloads from over 10 countries. So we like to say we're an international hit. If you are interested, if you're a podcast listener, you can actually, if you want to hold your phone up to the screen, you can scan that QR code that's on the screen right now, and that will take you to where you can listen to episodes, download episodes, hit subscribe. We've covered a multitude of different episodes, like Say You're Sorry and Mean It, All Feelings Are for Feeling, sensory play, developmentally appropriate practices. We've talked a lot about adult self-care. This season that started in January, Rudy and I have been doing some unscripted episodes where we kind of talk about hot topics, things that we've talked about in scripted episodes. It's really been a lot of fun, and we tend to find ourselves focusing on self-care a lot. So I think it's really important that we all understand, directors, providers, teachers, parents, everybody needs that, the taboo taken out of self-care. And I think Rudy and I try to really do that a lot. If you aren't able to scan the QR code, the link is in the chat box if you're interested in that. Rudy makes infographics for every scripted episode, which are just amazing. Those are available on the second link that's in the chat box right now on our KU website. They are open source for you to share, take a look at. They're just quick hits of what was in the episode. We also we've done some interviews with voices from the field, and we're looking forward to doing that some more. And you know, if you're interested in following us on social media, Rudy also does an amazing job with our social media posts. She is definitely the yin to my yang with this project. So obviously something I'm very excited about, something that we've had a lot of really good feedback about. We've been really excited that we've been able to do this through the ITSN and workforce development projects. Chelsea, is there anything else I forgot? Anything that needs to be added? So I'd stop rambling about this. Okay.
Hi. Sorry, I had to find my unmute. Always think it moves. So my name is Bernie Howe, and I am a training and technical assistance specialist on the Workforce Development Project, and also coordinating our preschool development subgrant projects. Chelsea, you can go ahead and move on. So they are all, we have 3 subgrant projects, and they are all based around the idea of cohorts. And so what a cohort is essentially builds upon a lot of the concepts that you heard Vicki talk about and really Sarah talk about with our training and support and technical assistance programs, but it just kind of expands and extends those concepts. So we know that that child care providers need support, and support and learning in a peer model actually drives change and increases quality. And so what our cohorts do is they are extended or intended to be long-term peer group interactions. So with that, what's included with them? You can go ahead to the next slide, Chelsea. So what's included in all of our cohort models is a trained facilitator. And so we have 3 separate, like I said, 3 separate projects. One of those is very locally based in Manhattan and Riley County. And that one is of a small kind of intimate group of providers that is focusing on wellness, provider wellness and program wellness. And Haley, who you also heard from today, is actually working with those providers. But then we have these 2 statewide projects, and they both take a similar approach, but just slightly different focus. So they are active for a year with CDA Facilitator Support, and those facilitators are trained training and technical assistance specialists. And so their role in the group is really to kind of guide and focus the interactions and to help provide resources and training to the group based on group identified needs. But I think that the real benefits to these groups is the peer support. And the reason why we have these, with an extended period of time is really to build that peer group up so that these childcare providers can be a resource to one another, even outside of the facilitation period. The goal is that they'll continue to be able to rely on one another. And so to qualify to be in a cohort, for both cohorts, they need to be licensed child care providers. And we're really focused on frontier and rural counties in the state based on the needs assessment and knowing that, that those areas of the state need support. Regional cohorts can be any type of childcare license. So, child care centers, preschools, and family childcare all will qualify under that cohort. Where our new provider cohorts are really more focused on family childcare providers, so KDHE licensed daycare homes and group daycare homes, and those that are newly licensed, so which we define as within the last 24 months. And the new provider cohorts really are focused on giving those providers the information that they need to help build a successful business. So, this could include business practices, self-care, all of those kinds of, starting a new business and, understanding that a lot of times family child care providers specifically are kind of starting their business in isolation. So we're really trying to build them up, provide that support. So in both cohort models, I think that the way that this is set up kind of provides something for everyone. but both cohorts include free KDHE approved training, as well as technical assistance with, like I said, their CCCTO facilitator that they build that relationship with, and then also resources and materials to help support program growth based on the training topics and identified technical assistance topics. I think that I think I turn it back over to Patty to wrap up. Is that right? I don't have my list in front of me.
Bernie, I was just going to ask, in these cohort models, do they have to be face-to-face with other people?
Oh, good question, Chelsea. So currently the cohorts are completely virtual. So contact with their trainer or with their facilitator can happen through a variety of methods. And we're using Zoom primarily for the group contacts, but individual contacts can be via phone, Zoom, email, online chat. Our staff is really great at finding ways to meet providers where they're comfortable. Likely this program will stay mostly virtual, but with the possibility that post-COVID there could be some face-to-face interaction, but currently it's 100% virtual.
So I think I had the opportunity to hear about quite a few of our projects that we have going on, and I would just open it up for questions.
I have one. Vicki, when you were talking about all of these exciting new course types, I wondered, for providers that are interested in participating in those, what would be the best way for them to know when those opportunities are available?
So all of those are on our website on the calendar that Patty was talking about. You can go on there and look. If you don't see one, you can go on the course catalog and read a fuller description of the individual courses. And then below that, there's an option to look up future courses. So there's not a lot of dates right now, but we will be putting our July to December schedule up fairly soon. So that will open up a lot of dates.
Patty, are you seeing?
Yep. So the question is, what kind of guidance will CCCTO use to go back in person? Great question. So we are the workforce development team as a sponsor project of the university. We are under the auspice of the university guidance, as well as the Infant Toddler Specialist Network is a sponsor project of KU. So they have the same. And with that said, some of the factors that will go into play is, one-on-one interaction is one thing when one of our specialists is out in let's say a provider's home or in a child care center. That looks a little bit different from a training where they would be able to maintain social distance, making sure that we have appropriate facility for that. But another thing with those group trainings, like the Infant Toddler Specialist Network, as Sarah mentioned, is they have been providing training in person in center programs. It's also to know if the center programs, I know they've been working very hard to make sure that there hasn't been intermingling between classroom teachers. And so part of it's making sure when we do get to that point that we're able to ensure that even when we're in a center with their own cohort, if you will, of folks, that we can still maintain distance because we want to honor that as well. So, we are working, we've stayed in communication with our state partners, and we hope to see that day come soon, but until then, we've made adjustments, but we do definitely look forward to that day that we're able to be back in person. Well, if there's no other questions, that either we answered all the questions up front or we provided so much information it will take a bit to process. And please reach out to us at any time. If you have thoughts, suggestions, questions, we're always open to having that discussion. And with that, I'll hand it back over.
Well, thank you to CCCTO and all of their partners for sharing their projects and their work today. I think it's very helpful for all of us in our work to learn about what they can offer to us. And I know, speaking from experience as a former provider, that all of the work and opportunities and support that CCCTO offers is very meaningful to the early childhood work in Kansas. So thank you to everyone for being here with us today. And I hope all of you have been able to get some takeaways to bring back with you wherever you are. So our only last thing to cover today is just our reminders about some upcoming meetings. As mentioned before, the Early Childhood Recommendations Panel meets on the third Friday of every month. So that will be on May 21st. Our next bi-weekly webinar is May 5th. And so please continue to join us every other Wednesday at noon. We enjoy having you here, and I hope that you're able to learn with us. And the cabinet and stakeholder group meeting isn't scheduled until June 4th. So we've got a little bit of time before that. We always invite you to share your feedback on the Kansas Children's Cabinet website. So you can go to this link and do that whenever you want to. So along with the theme of April showers, spring Mayflowers, I want to just say today, when life throws you a rainy day, play in the puddles. And that is from our favorite Winnie the Pooh. So with that, we thank you again, and we wish everyone a great rest of your day. And we will see you in 2 weeks. Bye.